COVID-19 pandemic has positive and negative impacts on different aspects of lifestyle behaviors. Negative lifestyle behaviors are associated with an increased risk of adverse outcomes from COVID-19. While dealing with COVID, we overlooked the fact that people's lifestyles were severely disrupted. Many people have become physically inactive and developed irregular eating patterns, which leads to unhealthier lifestyles and aggravation of lifestyle-related diseases. COVID-19 pandemic has also caused significant changes to homes, working life, and also stress. A multi-sectoral approach promoting healthier diets and increasing physical activity can help in slowing down the diabetic epidemic and heart diseases. Beat Diabetes Myths and Facts will impact and help a large number of people to prevent or control metabolic disorders. Today we have with us Dr. Sushil Kumar Nagrani, MD Consultant Physician, Clinical Cardiologist and Diabetologist, Meera Clinic, Delhi, Dr. V. Ashwin Karuppan, MD General Medicine, PG in Diabetology, PG in Cardiology, Consultant in General Medicine, Gleneagles Global Hospital, Tambaram Medical Center, Chennai, and Dr. Chandan Modak, MD DM, FACC, AFESC, Senior Interventional Cardiologist, Dispur Hospital, Guwahati. Thank you so much, doctors, for joining us today. Let me start with you, Dr. Sushil. COVID-19 seems to affect people with diabetes more adversely than others. They may show more long-term effects than others as well. What extra precautions should people with diabetes take post-COVID recovery?
It is true that COVID-19 infection more adversely affects diabetics. It causes more weakness, fatigue, exhaustion, body aches, insomnia in diabetic individuals. It causes more incidence of urinary tract infection, chest infection, and mucormycosis in diabetics. COVID-19 infection has been found to increase blood sugar values adversely, and therefore high blood sugar values can cause increased incidence of cardiac strokes, brain strokes, and renal complications. It is important for diabetic individuals to control their diabetes during and after COVID-19 infections. They should monitor their blood sugar values 2 to 3 times in a day. They should not miss their medicines, either tablet or insulin. They should not be afraid of taking insulin in COVID-19 infection. They should remain under supervision of their physician very, very regularly.
Dr. Ashwin, doctors recommend changes or you can call them modifications to one's diet to help manage chronic health conditions. What type of diet will you suggest to people with diabetes post-COVID recovery?
So usually a normal human being requires 2000 calories per day, and this calories has to come from a balanced diet. It cannot be a specific diet like keto diet or a paleo diet which is deficient in particular nutrition. Usually we tell the patient a plate related method where half of the plate needs to contain vegetables, which includes 40%, and then 10% of fruits, 20% of proteins, and 30% of complex carbohydrates. We also tell our patients that do not take excessive salt or do not take excessive sugar if you are a diabetic, and try to avoid fast food related fried food items, and also that can prevent a lot of other disease apart from diabetes. It can also help to prevent cardiac related disease. It can help to prevent cancer and stroke. And drink plenty of water as much as possible, because water has as a detoxifier, which is actually help to detoxify your bodies of the toxins which you consume on day-to-day basis. So vegetables, includes fruits, will also contain a lot of vitamins and a source of minerals. Thus, it will help us to fight diseases. So always have a balanced diet and not a keto diet or a paleo diet or any diet which is deficient in other nutrition.
Sure. So balanced diet, and of course, I think what you rightly said, water. That's something very important. Dr. Chandan, post-recovery of COVID-19 infection, otherwise healthy people are experiencing an increase in blood pressure. Is it normal? Will this elevated blood pressure come back to normal at some point?
Yes, post-COVID recovery patients are showing to be having higher than normal blood pressure. This is not a normal phenomenon actually, but it may be due to stress or anxiety related to COVID. First of all, because of during COVID, there may be seriously ill COVID patients who are kept in ICU, so patient may be under ventilator on oxygen. So there are many stress factors. Patient may have anxiety, and also there is release of stress hormones those patients usually get steroids also. So steroid is one confounding factor which causes high blood pressure, high blood sugar. So these factors may contribute to the high blood pressure after COVID recovery. But also it has been shown in the trials, in the studies like European and American studies, also the Chinese papers, they show that there is much more common incidence of hypertension in those having COVID than non-COVID population. It is around 50 to 60% patients are having high blood pressure after COVID recovery. And yes, it is reversible if it is due to some reversible causes, like if it is due to drug-induced hypertension. So patient will recover after say 1 month to 6 weeks. If it is due to mental stress, then it will be better day by day. But if the patient is elderly and the patient has already got high blood pressure or other risk factors like obesity, diabetes, those patients are have got lesser chance of recovery because hypertension will be permanent. So the basic mechanism they have shown that the virus has got some spike protein which binds to or angiotensin receptor, that is ACE2 receptor. So that is said to be one mechanism of hypertension in those COVID patients.
Dr. Sushil, people are still unaware of the importance of regular blood sugar monitoring. They think they will get some symptoms if their blood sugar rises. Can they experience blood sugar rise without any symptoms?
In India, it has been found that 42% of diabetics, they remain asymptomatic. Symptoms, they appear very late in diabetes like weakness, exhaustion, increased thirst, increased urination and weight loss when blood sugar remains fairly high for a very, very prolonged time. Therefore, monitoring of blood sugar at regular interval is very important for early diagnosis and its management. HbA1c is also very simple and easily available laboratory test which can be done at regular interval. It gives you an idea of blood sugar values of approximately 3 to 4 months. For good control of diabetes, HbA1c has to be maintained between 6.5 and 7.
Dr. Ashwin, obesity is a major risk factor for diabetes. Can obese people get rid of diabetes if they reduce their weight and follow a healthy lifestyle?
Yes. Today, if you see, there is a combined terminology which is called diapesity, which comes from obesity and diabetes. In many obese patients, the primary problem is insulin resistant. That means that they have adequate insulin, but it does not act because of the excess fat and it does not bind to the correct site. Thereby, it produces a spike in sugar levels. So it is always advised eventually that reduction of body weight up to 15% can actually put your diabetes in reversal, or it can also help you go into remission, which is a temporary control of diabetes.
Sure.
A 5% of body weight can drastically reduce your medications, and some people can go from insulin all the way back to tablets. And some people who are taking regular tablets can also skip tablets or can become a non-diabetic status. Not only this, apart from which the major risk factor for obesity, which includes stopping to smoke, probably cut down on your alcohol regularly, have a balanced diet, and exercise of 30 minutes per day can lead to sustained weight loss and healthy lifestyle, thereby trying to put your diabetes under remission.
So weight loss is really important, right?
Yes, it is really important, especially people who are obese. The primary cause in our country is because of obesity. There is a lot of people who are diabetic, especially young children. We can find them in schools now. They are turning out to be diabetes, and a lot of this work from home has put a lot of young people at risk. So obesity, reducing obesity definitely reduces the risk of diabetes.
So on that note, we're going to be taking a short break, and like Dr. Ashwin just said, it's really important to lose those extra kgs so that we can stay fit. We'll be right back. Welcome back. You're watching Beat Diabetes Myths vs. Facts. Dr. Chandan, it is still a grave shock to hear that an apparently healthy person underwent a cardiac arrest. How do we understand this in perspective?
we can see that nowadays cardiac arrest is very common especially among healthy young people. And that is actually really a great problem for our society. So we should be very much aware and very much uh, aware of our heart and our heart diseases, and we should know what is cardiac arrest, how we can prevent it, so that we can prevent it. So cardiac arrest is basically, it is an arrhythmia. Arrhythmia means normally our heart beats at around 60 to 100 beats per minute. But during cardiac arrest, what happens suddenly, the heart starts beating at 200 to 300 beats per minute or more than that. Or even the opposite can happen, like the heart will start beating at 20, 30 or 10. Heart will stop for around 3 seconds. Then patient will fall down and he will have cardiac arrest. So basically there are many causes of cardiac arrest, especially in young healthy people and healthy athletes. We can see that there are some arrhythmogenic factors like cardiomyopathy. There is hypertrophy of the cardiac muscle. Those people have got very thicker heart muscle, which usually leads to this type of arrhythmia and sudden cardiac death. So we can prevent it. We cannot treat each and every cardiac arrest patient, because this is the name itself is sudden cardiac death. So we can prevent it by doing a regular screening test. We can screen those athletes or young healthy people by doing one ECG or echocardiography, and that's why we can identify those patients who are at higher risk of cardiac arrest, and we can prevent it.
Dr. Sushil, healthy lifestyle changes are always good. Cutting down sugar in your regular diet really can help. But is it true that diabetes is caused by eating too much sugar? Because that's something which we all keep hearing.
Increased intake of sugar in diet definitely predisposes for the development of diabetes indirectly, in a way that increased sugar intake in diet increases the caloric intake, therefore increased incidence of obesity, and therefore increased incidence of insulin resistance. Insulin resistance predisposes for development of diabetes.
Dr. Ashwin, generally eating fruit is part of a healthy diet, but there is much confusion about having fruits in people with diabetes. Which fruits are safe for people with diabetes? Can they safely consume fruit juices?
So fruits play a vital role in our healthy diet. There is no forbidden fruits for diabetic patients, and your everyday diet should contain at least 10% of fruits, which serves as a great source of antioxidants and supply the essential nutrients. So diabetic patients are advised to consume low-caloric fruit, especially guava, apple, pears, avocado, citrus fruits, rather than high-calorie fruits like mango, watermelon, grapes, and custard apple, which has high glycemic content, and it can lead to a lot of fluctuations in your sugars. Usually, fruit juices are avoided by diabetic patients because it is easily digestible and it has high caloric value, and it can also bring down a spike in your sugar levels and thereby makes your sugar spike a lot and lose control. So eating fruits will be more beneficial compared to taking fruit juices, especially it can keep your satiety and it can also be a great source of fiber. So all the diabetic patients are advised to consume fruits on a regular basis so that it can keep your sugars under control.
So I think two important points here. One is, not having juice and consuming the full fruit, and also choosing the right fruit. That's an important point here. Dr. Chandan, smoking is one of the major risk factors for heart disease. If a person who is a long-term smoker stops smoking now, will his heart attack risk be reduced?
It is seen that once a patient has got a heart attack and he quits smoking, then the risk of heart attack, second heart attack, reduces significantly. And also it is shown in the studies that after 2 years of stopping the smoking, the patient will have 50% reduction in risk of heart attack and heart diseases. And after about 15 years of quitting smoking, the patient will have almost similar risk of heart attack as those who never smoked in their lifetime. So also it is seen that within 10 to 15 minutes or 15 to 20 minutes of stopping smoking, the patient gets normalized his heart rate and blood pressure also.
Dr. Sushil, regular physical exercise is a major part of diabetes management. When is the best time to exercise, for diabetic patients, and what type of exercises are safe for people with diabetes? What do you suggest?
Best time for exercise is definitely in the morning hours. American College of Sports Medicine recommends 30 minutes of moderate exercise for 5 days in a week and 10 minutes of weight training daily. WHO recommends 10,000 step walk for healthy living. Best type of exercises are aerobic exercises like jogging, swimming and cycling. Those who cannot walk, they should do sitting exercises. Dictum is walk, walk, walk and more walk.
Dr. Ashwin, exercise helps people with diabetes to control their blood sugar. If a person works out, does that mean he or she can eat whatever they like? Because that's something, people who are struggling with diabetes, they think, oh, I've worked out so I can eat whatever I want.
A 30 minutes exercise routine can help you control diabetes. It can also help you prevent cardiac diseases, reduce the blood pressure and also your stress. Exercise can help you burn the extra calories and also reduce the sugar fluctuation at the same time. We need to remember that by exercising and consuming more of calories, the excess calories can lead to weight gain. So ultimately, your sugars will go higher. Despite having an adequate exercise routine, you won't be able to keep your sugars under control. So consuming a balanced diet with a specified caloric value on day-to-day basis with regular exercise of 30 days or 150 minutes per week and a healthy lifestyle where you do not smoke, you do not drink and probably eat a healthy diet, I think you will be able to control your sugars well. So if you're exercising well, that doesn't mean that you should eat a lot. You should continue to eat a balanced diet and avoid overeating.
Dr. Chandan, is it possible to control blood cholesterol and triglycerides levels at a normal range without using any sort of medication?
Blood cholesterol and triglyceride level, these are very much fluctuating thing. That means especially triglyceride. Triglyceride level usually depends on our food. And that is the fatty meal. If we take fatty meal and test our cholesterol, triglyceride will definitely be higher. So actually fasting lipid profile is very important. We should check our cholesterol, all cholesterol levels during fasting, 8 hours of fasting. So after that, if treatment is necessary in those who have already got heart disease or at risk of heart disease in future. Otherwise, suppose a young patient of less than 20 years or 20 to 40 years, but no history of heart disease or heart disease related risk factors and cholesterol levels are not very high, we can manage by exercise, regular exercise, at least 30 minutes of exercise 5 days in a week or 20 minutes of vigorous exercise 3 days per week is sufficient to control cholesterol, especially those who are young and those who do not have any kind of heart disease.
Thank you so much, doctors, for joining us and speaking on this very critical issue. I think what we've really understood is diabetes is about managing the disease well, holistically, eating the right food, balanced diet, exercising, and staying away from the wrong things. Thank you all so much for watching.